In the last two lectures, we discussed about the toxicological data and how the toxicology is related to the development of drug molecules. And in last sessions, we discussed about the importance of toxicology as per the guidelines of OECD. And with this information, we introduce to you a new and hot topic of OECD, that is Organization for Economic Cooperation and Development, and the need of the OECD. What is the need of India for the OECD and what is the need of OECD for India. So, we discussed in the last sessions about the OECD and their guidelines in different sectors including finance and medical sciences. Now, in this lecture we are going to start a very new and hot topic that is related to the particularly for preclinical research and based on the good laboratory practice, that is GLP. Why it is important, how it is transformed into this stage, why, what is the need of the GLP into this world, and what are the major incidents that brought the GLP to these states. For this, today we are going to start with the GLP, the birth of the GLP regulations. In the early 1970s, the conduct of non-clinical studies, particularly preclinical studies, introduced for the conductance of new molecules. This led to the publications of the GLP regulations by the US FDA in 1976. The primary aim of the GLP is the driving forces behind the GLP principle is the need for the concerted actions among the OECD members countries to protect the man environment from the exposure to hazardous chemicals. It means the particular environment, the man is interacting with everything around us, the walls, the chemicals we are using in our rooms, the byproducts we are using in home remedies, whatever we are using, first introduced to the chemical toxicity assay, that is the assay of the molecules. And apart from it, whenever we are using any chemicals for the production or for the self use, the chemicals should not cause any hazard to environment. For protecting the environment and the man, we discuss and we develop the GLP. So, this was the core aim of the GLP, to protect the whole environment, including the humans and animals and the environment. Now, what are the famous examples why the GLP is formed? One of the labs that went under such an investigation made the headline is it is the Industrial Biotest. Now, come to the company. The Industrial Biotest is a company that is readily available for conducting preclinical tests. In preclinical tests, they are performing several tests using a skin irritation, toxicity for determinations, the LD50, ED50 and several dosing form. They are performing third party testing for a company known as a Syntex. Syntex is a major company, major pharmaceutical firm that is producing certain chemicals. And Industrial Biotest is a company that is performing some chemical tests for the Syntex. Now, Syntex give one chemical to the Industrial Biotest for conducting the test. Now, what happened with this chemical? The Industrial Biotest conducting thousands of chemical tests at randomly, but they are not maintaining the standards. They are conducting the tests for the drugs, insecticides, herbicides, food additives, pesticides, cosmetics and cleaning products. During the study, it was found that the mice that they had used to test the cosmetics such as the lotion and deodorants had developed the cancer and died. But in Syntex, in this study, the Syntex did not report any kind of tumor, cancer or any abnormality to the US government and the concerned department, United States Food and Drug Authority. This led to the generation of the GLP guidelines. Another big examples, the Sarle company. Long-term use of prescription drug Flagyl. Flagyl is commonly used for the infections in vagina, for edema, for several disorders for human use. It is in practice, doctors are prescribing in US market and more than 2 years it was in the market. But after a few years, our independent researchers from any other universities claim that it is carcinogenic in nature. Now, what does it mean? It means after the consumptions of flagell, it may cause some kinds of cancer in our body, and that research is published in Nature Index Journal and also indexed by the National Cancer Institute. Then some of the agencies, particularly US FDA, focus on these studies, and in-house study they perform the in-house they perform the non-clinical studies of the flagell, and they found that it caused some kind of adrenal carcinoma. That information is shared with the Sarle and company, but upon the exposure and disclosure of this information, the Sarle company completely denied the fact that the molecule, the flagell, is not forming, it not responsible for any kind of carcinoma. It means ये किसी भी तरह का कोई भी कैंसर कॉज नहीं कर रही है. Upon reinvestigations of the data, it was found that the Sarle and other companies who are performing the non-clinical data, their data is not accurate and the data is submitted is not up to mark. These are the major blunder in the history that lead to the generations of the GLP guidelines. The outcome of these studies was the lack of personal training. The person who is performing the training is not expertise. For example, someone who is performing the oncology study is not a knowledge of the practical of oncology studies. Deviation from the study protocols. They are just manipulating the protocols. For example, the temperature of the drug, the in-house animals, the quality control of the drugs, problems with the accurate, adequacy and contemporaneous documentation. They are not maintaining the data for the repetition of the study. These are the some major blunders conducted by these companies. Retention of the data, we cannot retain the data, and unexplained discrepancies, changes to the data, lack of quality control of the reported data, lack of quality assurance procedures and test articles, characterization and administration problems. Now, what is the administration problem with the drug? Whether it is administered through the oral or IV or any other routes, there is no clarity on the administration of a dose and the dosage form. It means sometimes what happen whenever we are taking our drugs, we took orally and sometimes it is given by the IV. Do you think what are the reasons why we are taking some drugs at the oral and why some are using the through the injections? The main difference between these two methods is that some tablets after ingestion into our body are degraded by the gastric juices. So, to avoid that degradation of the chemicals, we discovered that intravascular, intravenous, intramuscular or any other routes that parenteral can be used for preventing the degradation of the molecules. But in these studies, there is no clear evidence how the drug is administered. This is one of the major blunder found in that studies. Now, the significance of adverse findings was meant less severe. For example, after the administration of a dose, some mice, some animals found they are causing some dizziness or any kind of severity based nausea or any cancer, alopecia, pain, abdominal pain, but these reports are not shared with the agencies. Use of questionable statistical procedures. For example, they have a 6 group, they can use the ANOVA methods for statistical analysis, but they are not using any good statistical analysis, they are not performing any good methods for statistical analysis. Omitting the data. Now, omitting data, what do you mean? During the study, they have conducted a study for 3 months. Some of the animals might have died. So, they are just removing the data of dead animals. It means they are showing the drug is no more related to the mortality. There is no mortality of the data. It means manipulation of data is conducted with the molecules. So, omitting its data is one of the serious allegation in the report. So, with these discrepancies, the GLP came into force with certain objectives. First, the most important, the GLP makes sure that the data submitted are a true reflection of the results that are obtained during the study. Whenever study is made, was the security of the data. The data is a true reflection, whether it is causing any side effect or a positive effect or a negative effect. it must be noted, it must be recorded at anyhow. It does not matter it is harming or not, but it must be recorded whatever the outcomes. Outcome may be negative, outcome may be positive. The first of all is to record each and every minute details of the study. GLP also makes sure the data is traceable. If I am claiming that a molecule ciprofloxacin antibiotic, I am focusing antibiotic actions. So, data must be present that the ciprofloxacin is antibiotic and it is traceable. Promotes the international acceptance of the test. The test should be performed, should be conducted in a good laboratory as per the as per the guidelines, so that the other countries and other OECD members and others nations can accept the data without putting any doubt on the data. Now, what are the GLP principles? The GLP have a major 10 principles. First is the test facility organization and the personnel. The quality assurance program, facilities, what should be the facilities for conducting GLP facilities, the apparatus used during the practical, during the test, and the quality of the materials, reagents, the test systems, test and reference items. For conducting the standardization of a drug using the HPLC, HPTLC, GCMS and LCMS, we require some kind of reference standard, so that we can calibrate our test drug with the reference items or reference solutions. Standard operating procedures, there must be some standard operating protocol for conducting the preclinical studies and some essays of the data. Performance of the study, reporting of the study reports, how to report findings of a study, what should be the parameters, what are the different quality tests for the study report. Storage and the retention of the records, and after the completion of the data, after the completion of the results, so how we can store the data, how we can store the reports, how we can maintain the records and the remnants of the materials. For example, we perform a study of 100 milligram of a drug, and at the last we left with the 10 mg. So how we can procure these materials for the future investigation. Now, the test facility organization and the personnel. The first, the test facility management's responsibility. The test facility management's what are the major responsibility of the test facility management response? First is the hiring of the skilled persons. It is a duty of the facility managements of personnel to hire, to recruit the best and skilled personnel for conducting the studies, to provide better infrastructures as per the study requirement. For example, if we are performing a study on the a new molecule, so it should be tested in a very good environment as per the humidity concern. Study director responsibility. The director's responsibility is to review the animals protocols, quality control parameters, and he has a good experience in conducting and overlooking of the projects. Principal investigations responsibilities, how the principal investigator is taking care of the projects for the data, for conducting of the studies, and how the data is reporting to their directors. Study personnel responsibilities, those persons who are indirectly involved in the conducting of the studies. What should be the quality? First is there are the three major important parts of the skill. First is ethos, the ethics of the persona, moral of the ethics, and the conduct. So what these are the three important sectors on which we can designate the persons for the personal responsibilities. And apart from it, the important is the skill sets. What are the skill sets are required? For example, in preclinical studies, some are experts in conducting the non-oncology study. They are very good for performing the CNS activities. They have a good knowledge of the CNS activities or apparatus. For example, some are working on the Rotorode apparatus. Rotorode apparatus is apparatus used for conducting the muscle relaxant activity. The person who is handling with the rotorode apparatus must be aware of the principle of the rotorode apparatus. What should be the rotation per minute? It should be 25 rotation per minute or 50 rotation per minute. If we are increasing rotation, so what will be the effect on the animal's health? First, what is the dose of the animals to be administered and what time and how much the difference between the two doses? So this should be the quality parameters for selecting a study and the persons, and this will be the as per the SOP. Now, the quality assurance program and the responsibilities of the QA persons. The designated individuals as a members of the QA team directly responsible to the management. Who is the owner of the firm? Who is the owner of the company? Reporting directly to the managers or company owner. QA member not to be involved. Where not to be involved? First, those who are conducting, the QA member should not be directly involved the conducting of the study. If he is involved in the conducting of the study, what would be the consequence? For example, I am conducting a study. I am the QA member, I am the QC member. So, how I can assure my quality? For these reasons, the quality assurance member not to be involved anywhere in the conduct of the study being assured, assist to the updated study plans and SOPs. There is no involvement of the QA person anywhere in conducting of the study. Documented verification of the compliance of the study plan to the GLP principles. The third point, the inspection to determine the compliance of the study with the GLP principles. Now, there are the three types of inspections. First is study based inspections, facility based inspections. Third is process based inspections. Study based inspections. Now, performing anti-inflammatory activity. This is study based, or antibiotic study, that is study based. In cancer, we can classify the cancer study for lungs, cancer study for breast, and cancer study for ALK positive 3 for lung cancer, for other tumor for skin cancer. So, we can classify the study based on the indications. It can be carcinogenic, it can be non-carcinogenic, it can be for general toxicity. So, we can classify the study based on the several types of inspection. Now, come to the second inspection, that is the facility based. When we are performing the test for plant based or synthetic drugs, first is the quality control of the drug and the estimations. For that, we need HPLC, HPDLC, GCMS, LCMS. This is the machines used for the quality control of the drug. Now, so we can classify that this company is majorly involved with the assay of the drug. So, this is a pure example of the facility based inspections. Another company is dealing with the animal studies or in vitro studies. So, in that scenario, we can say the other company is performing preclinical research, process based inspections. Certain company are the related with the quality assurance and the approval. So, we can say that these are the process based inspections. They are checking your process, the SOP, the methods, the methodology, and other process related with the testing of the drug. Now, the facilities. What should be the facilities for conducting a study based on the protocol? The suitable size of the place, construction and the locations. What are the suitable size? What is the constructions and the location? First is neat and clean, a large area for conducting the study, a different area for raw material, for quality control, for documentations, and a separate entry register for each in and out chemicals for personal and chemicals. Adequate degree of the separation of the different activities. If I am performing in vitro activities, there should be a separate area for the in vitro, and if I am performing in vivo activity, there should be a different and a separate area for the animal studies. Isolation of the test and the individual projects to the project from the biological hazards. Now, certain chemicals are under the investigations. If certain chemicals are under the test systems, so there is a separate classification between the standard molecules and the test system. There is a different separations and the segregation, how we can easily identify the two test and reference system. For that, we should designate a different rooms or the almirah with the different colors and the good recognizable and the good colors labels, so that we can easily identify this is the reference standard, these are test samples, and suitable rooms for the diagnosis, treatment and the control of the disease. Now, these three are important for conducting the communicable disease: diagnosis, treatment and the control of the disease. For non-communicable disease, we can release some of the guidelines, but whenever we are speaking about the communicable disease, so diagnosis of the communicable disease, it is communicable, it can communicate from the personal to other personal, from one lab to another person. So that's double door entry is required for the communicable disease. Treatment and the control of the disease, so that the if scientists are working on the communicable disease, they should be more conscious about the control of the disease. They should not spread to the whole lab or to whole system. Storage room for supplies and the equipments. The company who is performing the chemical test must have the raw materials, must have the equipments and some inline chemicals. So there should be a storage rooms and a separate rooms for the supplies of the raw materials, including the chemicals, using the reusable and non-reusable, consumable and non-consumable, and equipments. The equipments are normally used on a daily basis, or they are not purchased every time. So they should be maintained and quality control using the annual maintenance policies. Separate areas for the receipts and the storage of the test and the reference items. Now, they have a documentation park for the company. So the paper and the receipt must be placed in a separate record room. Separation of the test item from the test systems. Whenever we are performing a test items or calibrating, the test item must be separate from the test system. Archive the facilities for easy retrieval of the study plans. Now, after 2 years, the US FDA or Indian FDA is planning to performing a study. So, what will happen or how they perform the study? So, they need our protocols for the study. So, they can review our guidelines, they can review our SOPs and raw data, that the reports, final reports, samples of the test item, the specimens, they are in the protocols. They can pick anytime, they can conduct the study anytime. So, we should have a system, so that if anyone in the world, in anywhere in the country or outside the country, within the India, outside the India, they want to perform the chemical assay, any kind of assay on our reports, so we can they can easily replicate, they can easily perform the data. So we should perform such kinds of reports, we should report such kinds of data. There is no manipulation of the data, there is no kind of alteration in the data. So this way we can create a good GLP practice, and this should be the practice. Handling and the disposal of the waste in a such a way not to jeopardize the integrity of the study. Now, we are during the animal study or chemical study, a lot of waste is generated. So how we are wasting the dispose of waste, how we are managing the dispose of these chemical waste or animal waste. So we should have a different system for the managing the biological waste and chemical waste. And prior to waste, prior to inoculate in the running water, they should be neutralized and a minimum contamination to water can be done. So this there should be a set of guidelines for the chemical wastage, and a different set of guidelines are required for the biological waste. Now, apparatus, materials and reagents. Apparatus of appropriate design and adequate capacity. Now in 2025 we are performing a study on Tulsi. The common name of Tulsi is Osimum sanctum. Now whenever we are performing a study on Osimum sanctum, is required the standardization of the Tulsi plants. First is the what type of the leaf, stems, season, कैसा इसका सीज़न है, कब आती हैं, कैसा फ्लावर्स है, किस तरह के इसके सीड्स यूज़ होते हैं. तो हमें क्या परफॉर्म करना है, इस पर केमिकल ऐसे करना है, इसका पूरा क्वालिटी एनालिसिस करना है. एंड व्हाट आर द केमिकल्स प्रेजेंट. फॉर दैट वी नीड अ अप्रोप्रिएट एपरेटस. नाउ वी हैव 2 आइटम्स फ्रॉम द तुलसी प्लांट. एक तो हमने क्या करा, पानी में इसको बॉयल कर लिया, दैट बिकम्स अ एक्सट्रैक्ट ऑफ द तुलसी एक्सट्रैक्ट. सेकंड, हमने इसको एक एपरेटस यूज़ किया, क्लेवेंजर असेंबली. क्लेवेंजर असेंबली इज यूज टू एक्सट्रैक्ट द ऑयल. अब हमारे पास 2 तरह के प्रोडक्ट हैं, एक ऑयली प्रोडक्ट है, एक एक्वस प्रोडक्ट है. एक्वस प्रोडक्ट को हम कैसे क्वांटिफाई करेंगे, इसमें कौन कौन से केमिकल्स हैं, और तुलसी के ऑयल को हम कैसे क्वांटिफाई करेंगे, इसमें कौन कौन से एक्टिव मॉलिक्यूल्स हैं. फॉर दैट वी नीड सम इंस्ट्रूमेंट. उस इंस्ट्रूमेंट का सिलेक्शन हम कैसे करेंगे और किस बेसिस पे करेंगे. वी हैव 4 इंस्ट्रूमेंट राइट नाउ, HPLC, GCMS, LCMS and UV. So what are the right decision for us to select these instrument? For aqueous we use HPLC, high performance liquid chromatography, or LCMS, liquid chromatography along with the mass spectra. And for oily compounds, for any oily compounds we will use for GCMS, gas chromatography, mass spectrometry. This is the selections for the aqueous and oily compounds. For the right selection is essential for complete disclosure of the phytoconstituents. While performing the assay of HPLC or GCMS, we must document ki how much quantity we inserted, how much quantity is used for conducting the study. Documented inspections, cleaning, maintenance and the calibration of the apparatus. Prior to conduct the study, we must perform the cleaning of the instrument. A regular cleaning is essential for a good results. Maintenance, annual maintenance or biannual maintenance is required, and the calibration of the apparatus. The calibration is whether they are performing good results or not. Calibration to be traceable to national or international standards. As we have the guidelines for the quality controls, so we use certain guidelines of ICH, International Conference of Harmonization, other OECD guidelines for conducting the instrument standardization. Apparatus, materials and reagents. Apparatus and materials not to be interfere with the test systems. Chemical reagents and solutions should not be labeled to indicate identity, expiry and specific storage instructions. What do you mean by this? The chemicals, reagents and solutions should be labeled to indicate identity, expiry and specific storage conditions. Now, some chemicals can be placed without refrigerations. They cannot be degraded at the room temperature, but certain chemicals require a special condition to store their biological activity. Some chemical media, some in vitro chemicals are required for special conditions.